Clinical examination of the central nervous system. Memory impairment. When memory defects is suspected, it's usually easy, but it's important to exclude disturbance of consciousness as the cause. A short loss of memory may be due to concussion or epilepsy. The continuing memory defect may be isolated or be part of a diffuse cerebral disorder. In the latter case, dysphasia, perceptual defects, and general cognitive defects will contaminate the memory disturbance, making testing more difficult and even unnecessary when the deficit is severe and also causing dementia. When testing memory, distinguish between immediate recall, recent memory, and remote memory. Immediate recall is tested by asking the patient to repeat back a series of numbers in the order given, and then another series in reverse order. Patients can normally recall at least 6 digits forwards and 4 backwards. The 4 repetitions should achieve a correct response. Failure to immediately recall usually indicates either some impairment of consciousness, and is therefore very useful in assessing patients with recent concussion for degree of recovery. Or it may indicate a failure of attention either through emotional preoccupation with other symptoms or for other reasons. Recent memory is tested firstly by orientation there's orientation in time, place, and person, and then give the patient a name and address and ask him to record this. That's after 5 minutes. An alternative is to tell a short story and to question the patient after 5 minutes. The patients with the specific amnesic syndrome can with damage to the hypothalamus and mammillary bodies and also temporal lobes as a hippocampus will characteristically show a severe defect in recent memory. Remote memory forms part of a permanent store of information in the brain. Defects of remote memory imply a failure of retrieval. It's difficult to test more remote memory, although it's difficult recalling general information such as the name of the president or the party in power. This may indicate a general decline in memory. A failure in these tests with relative preservation of recent memory implies the early stages of a diffuse cerebral disturbance such as dementia.